Okay.
I'll just introduce you first.
Sure.
Okay. זהו דיוויד בטלר, שהוא אחד מחוקרי הכאב הגדולים בעולם, ואני הולכת לשאול אותו קצת על כאב. David, I just introduced you and I told them that you are one of the biggest pain researchers in the world and you wrote several books about pain. So I just want to ask you, what is pain?
Boy, what is pain? Well, it's something the brain makes to look after us and to make us change behaviour.
Okay.
A fundamental human gift. That's what it is.
Okay. So
it's natural, normal, and we don't survive long without it.
So what happens if it's too much time pain, like chronic pain?
Chronic pain, it's there for too long. Chronic pain is usually where a person's brain has weighed the world, judged their life, their circumstances, and usually produced too much pain. Mm-hmm. Chronic pain, usually overprotective.
Okay. Is that bad?
Well, initially, if there's been an acute injury, it's good to be overprotective to allow healing to take place, of course. Mm-hmm. But 1, 2, 3, 4 years, no, it's not a healthy thing.
So how do you change it?
How do you change it? You change it at multiple levels, and I think the main level where I'd like to see change is an awareness at government level, society level. Mm-hmm. Chronic pain is an epidemic. It's 1 in 4 people have an ongoing pain state that doesn't get better. Mm-hmm. 1 in 2 families have a person where pain seriously changes the family dynamics. It costs billions and billions of dollars. It's actually the most expensive health problem on earth.
So why does the painkillers doesn't help?
Painkillers don't help. Maybe because they're called painkillers. We like to call them pain softeners.
Okay.
And even the word painkillers suggests that pain is an enemy within.
Okay.
But pain is actually a protector, but it's just that many people actually overprotect.
So how come the medicine doesn't have us the clue, the magic touch?
Yeah, medicines, synthetic pharmacy is really helpful for acute pain states. We're very, very grateful. But for chronic pain states, no, they don't work very well at all.
How come?
The main reason is the heavy opiates, while they're really, really powerful for dampening down the neurone, the nervous system, over time they fire up or excite the immune system. Mm-hmm. And because our nervous system, of the trillion cells in our central nervous system, at least maybe 80-90% have an immune function. Mm-hmm. This is a really powerful part of the neuroimmune system, and over time the immune system simply takes over, and you can actually get more pain from taking long-term opiates.
What about surgery? How come if I've got like a back pain, why don't go to a surgery or a knee pain and replace the knee?
Well, there's probably too much surgery done on this earth, I think, and surgery also has a pain issue associated with it. Mm-hmm. 20 to 30% of surgeries done on this earth, at 2 years later, 20 to 30% of people still have an ongoing pain state. Mm-hmm. The incisional allodynia keeps going, and much of it is actually new pain. Surgery, there, brilliant for when you need something removed. Brilliant, of course, for back pain if you have a cauda equina issue, some tumour, some fracture that needs stabilising. But surgery for chronic back pain, it must be the final, last resort, if at all.
Mm-hmm. So if I was a patient, what would you recommend me to do?
If you're a patient with chronic pain, with modern evidence now, number 1, get a really good assessment and checked out by the medical system. The medical system, the doctors are good at finding the nasty problems. Get that cleared. Mm-hmm. They're rare, but they do exist. Secondly, the best evidence would be to seek knowledge, to seek understanding about why you hurt. Mm-hmm. That can be sometimes difficult for chronic pain states, because pain states can be driven by so many different and varied things, even things that people aren't aware might drive their pain state.
Like what?
A pain state could be driven by the news you read, by your understanding, by anything which is actually dangerous, anything out there which could be dangerous. It could be driven by people in your life, places you go, things you say even. It's bone on bone, that's danger. Even the smells or the sights or the things you see, the things you believe, these are all things which can make you more sensitive. And the science with this is strong now, because many of these things are then transported or translated into danger molecular patterns within the brain and the body, which are picked up by receptors, which then get the nociceptive and pain system essentially firing.
And you wrote a really good book about Explain Pain, which is translated to Hebrew now, that you can find
it's
online.
Explain Pain's now in Hebrew, and that's lovely to see. It's been translated in quite a few languages. Most of the randomised control trials on Earth that show that explaining pain and understanding it is good therapy have come off the Explain Pain thinking that Lorimer Moseley and I first wrote in 2003.
And what else? Is just understanding pain?
No, you can't just understand, then you've got to take that into life. Take that into life. And understanding pain often involves significant conceptual challenge, a re-evaluation of life and who you are and where you fit. And then quality movement comes into play. You've still got to get out there, move, let the brain retrain the brain, let the brain take the body back, let your brain be comfortable with activities in life that it once feared or were uncertain of. Get that going, then get back into strength, exercise, fitness, life and movement.
So if I've got like a chronic low back pain, I just read the book and start exercising? Will that be enough?
No, I think you need, for some people that might be enough, but for most people I think there's some guidance needed. Because if you've had pain for some time, then you have a person with pain for some time, their brain has a certain commitment, a strong understanding to what it is. And that sometimes needs significant change over time. So I think quality health professionals may help guide you on that journey.
Which kind of professions?
Well, it depends. It depends, because I think it's professions who are kept up to date with the new world of pain. And up to date means a real understanding of the things like the incredible plasticity of the brain or the bioplasticity of the body, that you can change right until your last breath. People who understand that nociception is not pain, that nociception is danger signalling up. People who understand that pain is a distributed event in the brain and that many contextual things in life can come and affect it. People who understand that active therapies are much better than passive therapies. That's the kind of profession. It could be physical therapists, it could be doctors, occupational therapists, exercise physiologists. Hopefully with all professions they can start to get some of these key modern ideas about how pain functions.
Okay. And if somebody who's got chronic pain is looking at this video now, do you have any advice or something that you want to tell them for them?
If someone has chronic pain looking at this video now, what you've been told in the past and what you've experienced may not be true, because all pain is changeable. Pain is something your brain, your body makes, and everything your brain and body makes is changeable. I'm not saying it's easy, but seek some guidance, seek some of the dangerous things in life or your thoughts of danger that have kept your system on alert, and seek more of the safety in life, guided by a good health professional to get you back to quality movement, appropriate medication, appropriate diet. The key thing I would tell anybody with chronic pain is it can change.
Thank you very much.
Hey, thank you. Thank you very much. And
תודה רבה לכולם. Say תודה רבה.
Okay, bye-bye Israel.
Bye-bye.
Good on you.